Welcome to Sports Doc Talk. Check us out at sportsdoctalk.com. I can't talk. What is going on with me? I'm a hot mess, Dr. Garcia. Welcome to the show, our orthopedic surgeon and sports medicine specialist. I'm tongue-twisting Will Sanchez. Dr. Garcia, how are you? We have a great guest, but before we get to him, how are you?
I'm awesome, and sticking with the thing, we have our logo in the background. Heart health for Dr. Dave. He's going to love that. So anyhow, I am good. I'm super excited for this guest. This is going to be, I've been waiting for something like this because, again, we've talked about this so many times. Bronny James, Damar Hamlin, and we talked about it. I talked to my friends that are cardiologists, but to have a celebrity cardiologist on with us today that's going to go over all this is pretty awesome. And I think this is a good episode, obviously, to go over everything. We had some technical difficulties with this, and this is going to be important for people to see. We had to salvage this episode, right? Because it was so valuable, and honestly, everything that hopefully we'll hear and everything else will be so important that we were able to save it. So I'm pumped. There's a lot of work to save this episode, but I really think that the viewers are going to appreciate it. So if it's a little different than our other one, just bear with us. But if you're listening on the Spotify, it probably won't be a big difference. If you're on the YouTube channel, it'll be a little different. But again, the content's the same. You're going to learn something. It's going to be more than you wanted to know about. It'll be awesome. And you might even get a little conspiracy theory on this one. Who knows?
Yeah, no, this, just to reiterate what Dr. Garcia is saying, this is a great episode. And that's the reason why we've gone through so much to make sure that you get the information, because Dr. Dave is damn awesome. His information is great, and we just really appreciate him. So as Dr. Garcia said, it's going to be a little bit different. We're going to do some segments. We're going to toss to what he's saying. But I think overall, the information that you're going to get out of it, you're going to be really, really happy. But before we do that, we know that we have some friends at the recovery shop because we talk about them all the time, all the goodies from the HR robotics and the NICE machine and all the other things. But let's not listen to me because I'm not the doctor. I use some of the stuff when I'm injured. But Dr. Garcia this is his wheelhouse because he's going to let the patients know what they could use from the recovery shop.
So thank you to our sponsors, Recovery Shop. You've seen it before. Again, for surgeons that want to go take their practice to the next level, their patients are going to come in and ask them, yes, that surgery sounds great. Your techniques sound great. I trust you. What else can you do for me though? What you're doing is not enough. I want more. And I'm going to tell them this is your option, right? You have this place where you don't have to go online and search for 15 different items to help a patient get back. You don't have to go on Amazon and find them something unique that's maybe not even from the United States that they're buying. This is a way they can get the top of the line ice recovery machines, the top of the line from a bending machine standpoint. Scar creams, you name it, all stuff that you wanted your patients to have that you have solidified as a good part of your practice. And finally, if you want something that's not on there, it's really nice as a surgeon, you can add it. Again, I get, this is a sponsored show, which is beneficial, but I get no cut for you signing up for them. So again, I just really wish that all surgeons offer this, because if I was a patient, I would want to know, like, what other options can I do, right? Like, there's only the insurance covered standard options, and that's not good enough for a lot of my patients. So it's awesome to have this extra thing. So thank you guys. So again, we're going to sidetrack back into Dr. Dave Montgomery. This is a cardiologist, founder of the Prevent Clinic, executive producer of his own podcast, TV personality. I mean, this guy's got it all, and you'll see why in a minute. But, again, will go after it too. But again, this guy, I'm so excited when we got this opportunity to have him on. You're going to see so many different things. We'll show you his website, his Instagram. Not a bad looking guy too. So it's going to be a great combination of things.
Yeah, no, it was absolutely amazing. And check him out, DaveMontgomery.com, amongst his other things. And it's so funny. We teased about it. It's like, what don't you do? And at the time we did the recording, we were having all this, remember we were talking about the weather. I was like, are you a weatherman also? He's like, yeah, I do the weather also. So he was absolutely great, and we appreciate his time. But to kick off the show, especially with the NBA season off and about, and one of the main things that happened on the off season was with Bronny James and what happened to him on the court when he was at USC before he got drafted to the NBA to play with the Lakers. And Dr. Dave has some great insight on that. Enough from talking about and hearing from us. Let's toss it over to Dr. Dave.
The truth of the Bronny James story is we don't really know what happened. And there's a lot of sort of gray area in there, right? He's practicing. This is last year. He's practicing and apparently collapses. Now, so, Doc, you know this. If you have one of the most common forms of fainting, we call it vasovagal syncope. Fancy words for your brain just shut the lights out because it wasn't getting enough blood. And when you have vasovagal syncope, everything goes down. So the opposite of the fight or flight system is the rest or digest system. The rest or digest, kind of think about it, rest. Everything goes down, you go down, the heart rate goes down, blood pressure goes down. But you also get some digestive stuff too. With the rest and digest system, your heart rate can be so slow that if I came up to you after you passed out on the court and checked for a pulse, right, Doc? Boy, I may not feel one for 4, 5, 6 seconds. And you don't have to necessarily have cardiac arrest. If you do that and you're not patient enough, what would you do? You would immediately start doing chest compressions, especially because it had been in the news. Everybody's talking about it. You've got arenas in high-level sports arenas and practice facilities like that. People are ready to go. What I think the wild card is there, just in that story, is whether or not they pulled out the AED, the automated external defibrillator, and applied it to his chest. Now, if they did that, the AEDs are pretty smart, right? I mean, it will tell you if there is a rhythm that is incompatible with life, and it will recommend that you shock the person. So here's the bottom line. If Bronny got shocked, he had cardiac arrest. If Bronny did not get shocked, you can't convince me that he had cardiac arrest. You just can't convince me. He didn't get cooled. We didn't hear anything. Now, listen, all of this is roughly speculation because we don't really know much. And it's his prerogative not to talk about it at all. His family's prerogative. Hey, you've got to, protect the brand. I got it. But if he had truly a cardiac arrest, and remember, the family came out, the representative of the family said he has a diagnosable anatomical condition and that it's treatable to the point where he'll be back to play soon. Something like that. You remember this? I remember jumping on Instagram as soon as I heard it. I was like, whoa, this is good.
That was surprising to hear.
Yeah. So I go back to, the old cardiology textbooks, wait, what condition gives you bona fide cardiac arrest? That you have an anatomical condition that is treatable to the point of cure. Now think about it. There are some conditions, and we'll probably hit on some of those, where we don't have a cure yet for the most common form of some of these cardiac arrests, the common cause. So I'm thinking to myself, well, what in the world could this be? This is like an episode of House. Like, what is this?
Yes.
And that's why I got back on those same networks and speculated. I speculated that in fact he did not have a cardiac arrest, that he probably passed out, and maybe listen, Doc, there's so many things, right? Well, there are conditions that you're born with. You have a hole in the heart, the top chamber, bottom chamber. There's electrical abnormalities, right? There are things that you could have that are treatable that will just make you pass out. And I think one of the big gaps that leaves everybody wanting to understand it is because you say, well, boy, this is happening a lot. Happened to DeMar Hamlin, top of the year, then happened to Bronny later in the year. Like, what's really going on? And it just sort of leaves us without any information about, what to do next. How do I protect my kid who's 10? I want him to play ball, but I don't want him to die on the field of play.
Enough of this. We finally actually want to hear about what Dr. Dave does, because he went straight into Bronny. We know it's a hot topic. You got LeBron James and his son playing together, but we haven't heard anything about what Dr. Dave actually does, minus my explicit and extravagant introduction of him. But please talk about, Dr. Dave, your passions for the industry, the Prevent Clinic, the Health Mastery Cafe show, all the marketing things you do for heart disease. You know, you're a real doctor, right? You don't just play one on TV. So tell us more about that.
I'm a cardiologist. I'm a preventive, non-invasive cardiologist here in Atlanta. And I recently, 6 years ago, I guess that's not so recent, but 6 years ago, I branched off from a very large cardiology and cardiothoracic practice to start my own clinic here in Atlanta called Prevent Clinic, with capital PRE, like defense, prevent. We want to get there before the event happens. The events that we're really focusing on are preventing people from dying from heart attack, stroke, and heart failure. And we know how to do that, right? And it's not just because Dave Montgomery started a clinic. It's like, that's the biology, that's science, that's the current state of medicine. And I just decided to practice in a different way than I was able to practice in a large group, and very happy about it. Our podcast is called the Health Mastery Cafe. And believe it or not, I started the podcast back in 2011 in Chicago. So I was still training in my last year of training at Northwestern University in Chicago. And I was struck by, when I was a second year resident, I was struck by hearing how heart disease is the number one killer far and away, and exceeds all of the common cancers combined. But there are two kickers here. So everybody kind of knows that. Not everybody, but most people know that. But the kickers are, we know what causes it. Grant, Will, we know what causes most of the forms of heart disease that kill people. We don't know what causes many of the cancers. Here's the second thing. We know how to prevent people from dying. So now, somebody's got to tell me, how does a condition, a set of conditions that far and away kill more people than anything else, that we know how to prevent from killing people, why is that still okay? Why am I still saying this right now to you on your podcast in 2024? And the problem to me is that we have a marketing problem. We have a public relations problem, but that's the bigger problem, right? That sort of came out in COVID. You know, we really have a PR problem. But the marketing problem, what in the world is going on where we can't get the basic message out to most Americans, most people everywhere? Remember, heart disease is the number one killer in most of the world. And say, these are the things you should do to prevent yourself from dying from heart disease. Now, I didn't say we could stop everybody from developing forms of heart disease, but we know how to stop people from dying, and we know how to help people recover. And so I just decided, way back then, that this, just seeing patients, which I love, do it every day, was not enough. That if I can just change one person, no, that's not enough. When are we going to say no? Changing one person's not enough. Changing large, at scale, lives, that's what we really should be doing. And so I decided to go into media, and boy, it was hard. Started off in print media. Then I went to radio. We'd do a live show every, once a week. I was kind of the Dr. Oz of this radio show. So I would I'd sneak off into the call room in the middle of the day on like a Wednesday. We're like, where's Dave Montgomery? Pagers going off, because we had pagers back then. Pagers are going off, me. And I'm on this 30-minute, call, taking it from the call room. And then I started doing television, and then this podcast came along after we had some success with television. And wanting to have long-form conversation. You can already tell I talk a lot, right? I want to have long-form conversations, but I wanted to do it in a way that was a little bit more approachable, a little bit more accessible, and not a whole bunch of scientific mumbo-jumbo. Like, I've got a bunch of scientific mumbo-jumbo for you, but that's not what gets to people. So I started it in a cafe in Chicago. It used to be called Crew Cafe. It's no longer there. And we'd have two microphones like this and be talking at the table, drinking whatever we were drinking. And that's where the name of the podcast came out, the Health Mastery. I think in order for us to be in this body, we got to be in this body every single day. We may as well master it. and just do it in a cafe, the Health Mastery Cafe. Boom, there it was. It sounded a little wonky. People told me that was a stupid title. I'm like, I'm sticking with it. It's like Google. Like who loved Google when they first came up with that title? But that's it. And so what we're trying to do now is elevate the conversations into the current topics that people are talking about, because there's a lot of misinformation. And I want to bring conversations to people where they are without, using a bunch of jargon, but hearing people's authentic stories. That's a real common word now in the common parlance, right? Authentic. But that's really what drives people. It's the emotion of story. And that's what we're doing here. We're taking people's stories, their health stories, and extracting keys and tools for mastery. And that's what we do.
So obviously, Dr. Dave is doing so many different things. We're really excited that he was here and able to provide all this information. The next segment coming up, he really kind of gets into really his passion, right? And that's screening athletes and screening tests. And he's going to explain in depth why these tests are so important. He's going to go over a bunch of tests, but really highlight 3 of them. And at the same time, he's going to talk about the lack of marketing. So, Dr. Garcia, when it comes to marketing in your field, how important is it? Because Dr. Dave is going to get into that, but just I want to know what it is for you as a surgeon, why marketing is so important for the patients to understand what options they have.
I mean, this marketing is, and you're going to hear from him, cardiologists don't do it well, orthopedic surgeons don't do it well. The marketing is essential. It's not just essential to get patients into your clinic from a clinical standpoint or surgical standpoint, but it's and most important actually to get your message out. And that's what we do this for. This is a unpaid thing that we do. We do this because we enjoy it and we want to get our message out. I want to teach people about these injuries. I want to teach people about these concussions. I want to teach people about these surgeries so they know they exist. They know the protocols. So if something they see doesn't seem right and they're like, listen, that does actually help. I mean, that's what I get a lot of my patients coming in for. They're like, I had no idea this was even an option. And that's why I do it, because I want to make sure that everybody gets the best possible care. And that's exactly what Dr. Dave does as well. So it's awesome.
Yeah. And besides the tests he talks about, the messaging of why it's important so people could get more of information, become knowledgeable, he hits us up with the Damar Hamlin and his thoughts on it. It's a must listen. So I'm really excited to tease what's coming up next, but don't listen to us. Let's go back to Dr. Dave.
I want us to come back to the Damar Hamlin story because I've got another angle. But before we do that, the message that came out, I think was really clear after Damar had his arrests, and he had more than one, was that we should be screening our elite athletes at the collegiate level, at the professional level, period. It is too simple to do a stress test, folks, to do something called an echocardiogram, which is an ultrasound of the heart, and to do a basic, exam and an EKG, right? It's too simple to do that, and it casts enough of a broad net in the cardiovascular world for that age group to be able to find the commonest forms of sudden cardiac arrest. The most common forms of sudden cardiac arrest would be found in those 3 things: EKG, echocardiogram, different than the EKG, electrocardiogram. So EKG, dots on your chest, ultrasound, echo, think sound, ultrasound, echocardiogram, and a treadmill stress test. Most of the ones, the anatomic ones like hypertrophic cardiomyopathy, HCM, or the electrical ones like long QT syndrome. We got a whole bunch of little fancy words, but many of those would be caught with those exams. Now tell me, somebody, please, in our elite athletes that we know are leaving high school and going to, really rigorous sports programs in college, collegiate programs across the country, or from college, and no matter when they're leaving, to professional. Tell me why we shouldn't. Is it the cost? Are you kidding? Listen, I don't even know who to talk to, but I could call Nike right now and boom, I've got a title sponsor right there to make sure everybody gets screened. Like, these are not expensive exams. And it's the point that you make, Grant, is because you're an elite athlete, you don't think about your health. It's the last thing you're thinking about. Tom Brady, how old was Tom before he said, I got to stop eating this crap. I got to stop drinking this getting drunk, the weekend before the game, the week before the game. Like it takes an evolved human being to go there. And I'm not really sure because, I was 22 before. I was not evolved at 22 thinking about, the implications for my health. Nobody's thinking about that at that age. You are running faster than anybody on the planet. You're hitting people. I mean, it's unbelievable the kind of feats that these guys can do, guys and gals, because it's not just guys, for example. But if we don't test, you don't know. That's what I tell patients all the time. You can feel amazing. We all have heard of stories of marathoners, triathletes. Oh my God, they were, so healthy, but what happened to them? Boom, we've all heard of it. Oh, he's about to cross the finish line. And that's not a myth, by the way. That's not like folklore. That's real. People, about to cross the finish line and literally have a cardiac arrest before they cross. We've heard of all of that before. Who's healthier than a marathoner? Nobody. So there are some things, and here's the other thing I tell my patients, Grant, not everything that can harm you hurts. Not everything that can harm you hurts. Not everything that can change your life instantly will give you a symptom. That means there's a bunch of things that are asymptomatic. And in this group of patients, or this group of people who we really are asking for so much, tell me why we shouldn't be doing it. Somebody, please. Tell me why we couldn't just spend, I don't know, $1,000, $1,200, I don't know, less. In my lifetime, I've never seen what happened to Damar Hamlin. We've never seen that before. So truthfully, it is rare. But it should just never happen. That shook the entire world. This is, there are some guys who were standing on that field that saw that right now are seeing a therapist. This is got far-reaching implications. This is not just, oh yeah, one guy had a cardiac arrest. These guys with PTSD, how many games did it take them to start hitting each other the same? Like a lot. I mean, we could have an entire movement afoot starting at sort of collegiate bound high school athletes. Just start with that small group and just screen those folks, because I want people to understand that although it seemed like there's a whole bunch more cardiac arrests, we had Caleb White after Bronny, and then before Bronny we had Damar Hamlin, like all of that, and it was in the news. But the truth of the matter is, kids have, playing sports, have cardiac arrests every year. It's about the same, 1 in 100,000. So I would get asked on the news, hey, is it more common? No, we just had 2 super high profile examples. Super high profile, like right in the middle of a game. Are you kidding? We've never seen that before. And then, the son of the king. I mean, we've never seen that. But the numbers are about the same. I will tell you that one of the things that I want to say here that I said, I just made a little small Instagram post because there was I got a lot of questions when Bronny had his event. Again, we don't know what happened. And they were saying, well, why is it more common in Black athletes? And it just sort of seems like that would be right, because there are a lot of different heart conditions that are more common in Blacks than there are in other populations, particularly whites. This is not one of them. And there's a number of reasons to talk about this. Number one, if we're going to start screening athletes, but you think that only a certain population of athletes is affected, what if you don't have that kind of athlete at your school? There are plenty of schools, great programs across the country that have 0 Black athletes, right? So if you think it's only Black athletes, you won't get an AED. You're not going to screen any kids. Are you kidding me? What's an EKG? What do I do that for? But here's the truth. It all came from an older study when it looked at a 5-year period of NCAA athletes. This is the only data that we had of this magnitude. And it really was a survey study, a retrospective study. And in that study, what it showed, and I pulled it up, I'm just going to kind of pull it up here just so I can kind of quote right from it. The main graph on this study, Grant, showed that there were 45 total NCAA athletes that had deaths from cardiac arrest in this time frame. Okay, the 5-year time frame. Here it is: 45 deaths. 11 of them were female. We don't really think females when we think cardiac arrest. It's a quarter of them. They're having cardiac arrest too. Of those, 27 of the 45 were white, 17 were black. Wait, stop. What are you talking about? It's more. I see. You have to do a statistical manipulation. Now, I've said on my my little post, Grant, that the larger public, the society doesn't care about some statistical manipulation. There were more white athletes that had cardiac arrest than there were black. And we have to say, okay, well, if that's true, that means white athletes are having them, but we should just start, when it comes to screening, when it comes to preventing it, we got to target everybody. The way that it happened, here's the bottom line. The way that it happened was the sample size for blacks was so much smaller than whites. And so when they did the rate, right, the death rate, it made it seem like there were more. And the question always is when you have an uneven, non-controlled, randomized control where both sides are the same, is if I had more subjects in one side, would the numbers of deaths change? So here it is. I don't want to get too wonky, but there were 300,000 athletes that they looked at. They call them athlete years, but to make it simplified for viewers, 300,000 athletes, let's call it. Those were 300,000 black athletes to 17 deaths. There were 1.6 million white athletes to 27 deaths. So you see, the rate makes it seem like that it's more likely to happen in black athletes. They're just more white athletes that are in this study, that are in the NCAA, okay? So the question always is, for people who are being statistically rigorous, what if those numbers were the same? What if there were 1.2 million black athletes? What would the numbers be? And that's why I said, hey, listen, the reasons for cardiac arrest, the main and common reasons for cardiac arrest are not more prevalent in blacks than they are in whites. HCM is not a condition more common in blacks. We know that. Long QT is not more common in blacks. ARVD is not more common in blacks. You get what I'm saying? So if we're going to be rigorous and be right about it and not just sort of have, something for the news, right? Because this has more implications than being sexy and attractive and pithy for your news soundbite. This is like people's lives. Like, who wants to lose their child playing sports? So let's get really wise about this. I see people across all races, across everything you can imagine, celebrities, not celebrities, you name it, judges, it doesn't matter. I see them all, and I care about every last one of them. And so I care about their kids. We don't want these kids to die. You should be screening all the athletes that you think are going to go to that high level, whether it's collegiate or pro, and it's easy to do. At the end of the day, we've got to say cardiologists, people who study heart disease, that's the whole cabal, all of us, we just don't market well. So the reason why it's not on, the radar for the Owners Association meetings is because nobody's making. No, listen, if we would do half of what Susan G. Komen did, think about this. I mean, you got big old defensive ends, man, pink all the way to the bottom, boom, pink, underwear, like everything. That's marketing. At least you've increased awareness to where the people who are involved in it are just so emotionally involved that they don't care about what color. That's the marketing. So let's find the Susan G. Komens for the heart people. That's what I think the main things, and the main reason is that we don't see it more commonly now, and that we're still talking about the need for it now is because not somebody else. It's us. And until we take responsibility and say we're going to do something differently about it, and then go and get some supporters and sponsors to make it as big as Susan G. Komen has done, then we're going to keep having these conversations. I think that athletes get smart when they leave, right? Because I actually do. I see a lot of former athletes. I see referees, active referees across sports. And, they come in and, sometimes I have a question like, man, if we could just get your whole team, because I'm marketing, man, okay? If we can get your whole squad to just get one of these echoes, wouldn't that be great? I actually know people in the PA, to kind of, help run that. men and women in the different player associations, and it happened to be patients, right? And when the Damar Hamlin thing, I wrote something up, boom, slide this over. I don't care who you slide it to. I'm just shooting my shot. Somebody's got to start thinking about this. And before I'm done talking and yabbering the time when I just hang up my jersey, my podcast and TV jersey, I will have done the best that I could to try to get the message out. I did want to hit Damar Hamlin if I could, because I don't know if people remember. If you don't remember, I want you to go back to the video. There's a lot of different clips on YouTube. We all were asking the question, what happened to Damar? And it was, just sort of one of the more popular things to say that he had what's called commotio cordis. That when you get hit in the heart at the very wrong time, and you hit it at a certain phase of the EKG, if you will, the electrical activity, it can throw it into a very chaotic heart rhythm. And that chaotic heart rhythm causes your heart essentially to arrest. It stops beating, and you have cardiac arrest. That has to happen with a relatively direct blow to the chest and at the right time. We've seen that in lacrosse. Sa, pow, right? Hockey, bang, right? We've seen that before. If you get baseball. Yes, okay? If you go back to the hit, Higgins on Hamlin, speed it up, go double time, slow it down. It doesn't matter. Watch every angle. I watched every angle before I got on the news. Every angle, he did not hit him hard enough. Go back and I wish we had a clip. He didn't hit him hard enough in the chest and direct enough in the chest. There was one view, guys, that I saw, and it was from over here, okay? Damar, the helmet of Higgins went up and into the jaw of Damar Hamlin. Now, let's stop for a second. The jaw is I don't have to tell the orthopedist. The jaw is an extension of the skull. I mean, come on, he's getting his bell rung, I don't know, 5 times a year. He gets his bell rung. When he went down, do you remember what he did? He stood up. Now, Doc, he stood up, he adjusted his helmet, and about 2 seconds later, what did he do? He went down, and he went straight down. He had lost consciousness now. He didn't guard himself. He didn't brace himself. His arms didn't go out, and he popped his head again. Now, I know it's not popular. I said it on a whole bunch of outlets. Until proven otherwise, he had traumatic brain injury, right? He had traumatic brain injury that turned into a traumatic cardiac arrest. We've seen that before. That's not like something new that we just made up. You can have such a traumatic brain injury that you go into cardiac arrest. That's known. And if you think about it, his heart didn't stop immediately. Commotio cordis, my friends, your heart is not doing a thing. It's shaking. Pop, and are you going to get up and have enough blood flow to the brain to adjust your helmet, right? And then he was moving when they first went to him. His legs were moving. You don't move a thing when you've got commotio cordis. Think about it. He wasn't in cardiac arrest immediately. Commotio cordis doesn't say, let me wait for it, boom, let me get, no. That's not how it works. And I know I'm going to be a little tongue-in-cheek, but that's not how commotio cordis works. So I'm sitting there as a scientist. I'm like, that's not commotio cordis, guys. And then, remember how long it took for the paramedic to come out and start to, right? I mean, that was a long time. Commotio cordis doesn't behave like that. It's just not biologically feasible. I mean, somebody falls from a high altitude and lands on the ground, they go into cardiac arrest. Not because the heart got smashed, because it was such a traumatic thing. You get this overload of adrenaline and all the other hormones that make your heart, and you just go into arrest. So we know that this is a real thing. I did want to just sort of talk about how he went back into cardiac arrest. So once they got his heart back, which if you get there fast enough in commotio cordis, Okay, maybe you can save him. But to your point, Doc, listen, it's really hard to save him in commotio cordis. They got him to the hospital, and he went into cardiac arrest again. If it were commotio cordis, he didn't get hit again. Why did he go back into cardiac arrest? Now, you could say there's a number of reasons. Oh, the fluids, all the stuff. And I think that that's feasible. And maybe that's a weaker point of what we're talking about. But when he stood up and adjusted his helmet, he reminded me of Tagovailoa when he got his bell rung a couple times. You remember that? He got up. Yeah.
Talk about that, all that stuff on the show.
Right? Yeah. I mean, he was stunned, did that. But, right? It was a similar kind of thing. Now, it's not sexy for the NFL to have heard that, but I also said on Tom Lamas, listen, the NFL is doing the absolute best that they can to try to make this game as safe as possible. We've never seen that before. Come on, it's a first time for everything. It's not like they were like, oh, yeah, we don't care about the players. Nobody believes that anymore. We just have never in our lives seen that kind of hit. And guess what? You're not telling folks, hey, got my bell rung, right? If you get up and stupor around a little bit, okay, you got to go on, concussion protocol. But I mean, there are a whole bunch more bells rung than we'll ever know about, right? I mean, think about Pop Warner. You don't even talk about it when you're like this big. So it could very well be that was just the last one that his body could take. He was like, oh, well, that's not enough. How do we know how many he's had through the course of 2 years, 3 years? I don't know. I'm really excited about this movement toward body imaging, full body imaging for, the general population, but certainly for athletes. I'm looking forward to AI being dovetailed with the current medical science and turning scans into super rapid, accurate exams for stuff like HCM, ARVD, right? I mean, some of the structural stuff that we can see that changes people's lives. And then some of the other things, right, Doc? So, think about if you've got this super fast, imaging, MRI, that you don't have to, take somebody way off, across the city to get a really high-tech MRI. And so when it comes to imaging and preventive testing, that's what I'm excited about. I can't wait till they get this right so that it's not such a big deal to have your college athlete who is going to the pros to just go to one of these centers, do the test and come out with, what to do, what not to do, what to eat, what not. I mean, that kind of stuff.
We really hope that you, the audience, had a chance to learn something, to be excited about it, and really to get some information. I know for myself, whether it's the echo exam, the EKG, the stress test, just I'm getting older and we're talking about it from someone my age, but really the importance of our young athletes that are playing football, playing these sports, to have these tests, to find out about Damar Hamlin. We can't thank him enough. What were some of the key points that really you took away from Dr. Garcia as we get ready to wrap up our show?
I mean, so many. First off, Dr. Dave, thank you for being on here. This was awesome. I mean, just to be able to have someone of your caliber, the way you were able to effortlessly explain this and go through so many different scenarios. I feel like we could have done 2 or 3 hour show, but our listeners would probably get exhausted, but I took away, the Bronny James thing is fascinating, Damar Hamlin. And then just the points you make about the ease of testing and how we are under testing because it's people don't understand that, right? Like, the big glitzy stuff, the sports stuff, the orthopedic stuff that we talk about, that gets in the news more frequently, right? We talk about that all the time. But these type of tests are actually save lives. Like what I do, I love my job, but I don't frequently save lives. You save lives, which is awesome. And so that's what the important part here is, that we can save lives. It may not be that many with these sort of tests, but even one counts, right? Because anytime someone passes away from something like this, it's all over the news. We don't want that. Right, we want these people to be saved. And so it's an opportunity to save lives. So thank you again. This was amazing. And thank you to all your listeners. This was well worth it for us to get this episode on for you. And I hope you learned a bit.
As we wrap it up, just remind everybody, check them out. Health Mastery Cafe with Dr. Dave. The Prevent Clinic. He's at Prevent sportsatl.com because his clinic's at Atlanta. So if you need some more information, there it is. And as always, check us out, sportsdoctalk.com. We have our shows. We get feedback from you, the listeners and viewers, and we love it. It means so much to us. That allows us to do other shows. We have transcripts. We have a plethora of information. It's just been great, and we really appreciate you. Dr. Garcia, last words as we wrap it up.
Always fun to have a guest, especially like this. So thanks, guys. Thanks for
I love
listening.
your background, Dr. Garcia. I just want to say it one last
heart
time.
health today, a little ortho and a little bit of heart at the same time. So
All right, we're out on that one. Thanks for listening. Bye.
take care.